What is dysphagia or difficulty in swallowing?
As the name suggests, if there is any difficulty to swallow what we eat or even saliva, that is in medical term that is dysphagia, which is called as Odynophagia, which is painful swallowing, means there is pain in the throat during swallowing. These are the two terminologies and it is quite a common problem.
What are the other symptoms that can be associated with dysphagia and Odynophagia, and how can they be differentiated?
It is a common problem, very common symptom. In general, the prevalence of dysphagia or difficulty in swallowing is around 10 to 20%.
What are the causes of dysphagia across all age groups?
Younger age group causes of dysphagia, not so dangerous conditions.
Hello everyone. Today we are here with another topic on gastromedicine, and I'm Dr. Riya Shahar, MD Medicine, and we have with us Dr. Krishanu Boni, board medalist gastroenterologist. And today our topic of discussion is dysphagia, or which is defined as difficulty in swallowing. And a subtopic will be Odynophagia, which is painful swallowing. And now coming to the discussion, sir, what is dysphagia or difficulty in swallowing?
As the name suggests, if there is any difficulty to swallow what we eat or even saliva, that is in simple terms that is dysphagia. In medical term that is dysphagia. And as you mentioned, there is another thing which is called as Odynophagia, which is painful swallowing, means there is pain in the throat during swallowing. So these are the two terminologies and it is quite a common problem.
So what are the symptoms, apart from the terminologies you have explained, difficulty and painful swallowing, what are the other symptoms that can be associated with dysphagia and Odynophagia, and how can they be differentiated?
Look, it is a common problem, very common symptom, and we have seen that in general, the prevalence of dysphagia or difficulty in swallowing is around 10 to 20%, and the proportion increases with increasing age. Also, it may be associated with some other symptoms like choking during swallowing. That means problem created to breathe properly, and there may be nasal regurgitation, or when there is an attempt to swallow, the food or the liquid comes out of the nostrils. So this is called nasal regurgitation. There may be coughing, and sometimes excessive salivation, and there may be a sensation of some foreign body within the throat, which we doctors know as globus. So these are the common associated symptoms which are seen along with difficulty in swallowing. And there are also some other symptoms not directly associated with difficulty in swallowing, which is loss of weight. If there is a rapid loss of weight, or sometimes maybe there may be wheezing or stridor. That means noise like flute-like noise during inhalation and exhalation. So these are the other associated symptoms associated with dysphagia.
So, like you mentioned, dysphagia is more common with increasing age. So what are the causes of dysphagia across all age groups? Different age groups.
In younger age group, causes of dysphagia may be not so dangerous conditions. Sometimes we see that some acid peptic disorders can lead to dysphagia, and in Western world, not so common in Indian subcontinent, there is a disease called eosinophilic GI disorders, which is a kind of allergic problem that may cause difficulty in swallowing. and there are some functional causes of, there are some non-structural causes of difficulty in swallowing. These structural causes mean there is some obstructing lesion within our digestive system, swallowing swallowing apparatus, like some tumor, like some ulcer. When there is no identifiable obstructive lesion, then we can call it as non-mechanical or non-structural dysphagia. There is a disease entity called achalasia, which is a disturbance of coordinated function of our food pipe. Its muscles are not working properly in that condition. So this is another common cause of dysphagia. And as people grow older, then the more grave causes come into play, like tumors of the larynx, that means the upper part of the respiratory system, or the tumor of esophagus, that is our food pipe. So these are more common causes of dysphagia in higher age group, in older people.
So then, like you mentioned, there are some structural and non-structural causes of dysphagia. How can you differentiate? How can we differentiate between structural and the functional causes of dysphagia based on presentation?
For common people, it is It is very important to understand which thing is not so dangerous and which needs emergency medical attention. So when a person experiencing difficulty in swallowing, suppose following some new prescribed or non-prescribed over-the-counter medicines, after taking some medicines, so medicine is a very important cause of ulceration in our food pipe, which may lead to difficulty in swallowing. So it has a temporal relation with some inciting agents, like suppose someone is taking some painkillers or some calcium, iron or bisphosphonate kinds of drugs, which are more commonly prescribed for orthopedic purposes. So these medicines may lead to difficulty in swallowing, and these are not so dangerous because these are easily treatable and these are almost completely curable. But when it is dangerous, if an elderly patient or elderly individual is having new onset difficulty in swallowing foods, which is associated with a significant weight loss, or the difficulty in swallowing is progressively increasing day by day. It is not like that. Sometimes it's happening, sometimes it's not, but it's continuously present and it is worsening. Then these are the situations where medical advice should be sought on an urgent basis. So these are the distinctive features which should be identified at home by any individual, that he or she should or should not go for a treatment in an urgent basis.
Then from this discussion only we are getting the answer that these are some serious conditions that can complicate the prognosis of the patient, and the patient has to present to the doctor. So is there any classification of dysphagia?
Yes, we can classify dysphagia, and it is mainly because of ease of investigating and treatment purpose. We can differentiate it between dysphagia to solid foods and dysphagia to solid and liquid or only liquid foods. So when it is difficulty in swallowing for the solid food only, we can clinically assume that it may be due to some structural or obstructive causes. But when the difficulty swallowing is for both solid and liquid foods, then the cause may be the other things like functional or non-structural causes, as we discussed about achalasia. There are some neurological problems. So this is the broad category of dysphagia, and there is another classification which is called dysphagia of the difficulty in swallowing due to the problems of upper digestive system and due to the problem of middle or esophageal digestive system. So when the problem lies in the oral cavity or at the back of oral cavity, then it is known as, for the medical fraternity, it is known as oropharyngeal dysphagia. And this dysphagia, this difficulty in swallowing is most commonly due to either some structural problems in the back of our oral cavity. There is a situation called Zenker's diverticulum, which is a pouch-like outward expansion of the upper digestive system, and which can lead to obstruction of our swallowing process. And there are some neurological disorders or neurological diseases, like in patients who have suffered a stroke or Parkinson's disease. There is a condition called amyotrophic lateral sclerosis, multiple sclerosis. These are causes of the nervous system disorders that may lead to difficulty in swallowing. And these oropharyngeal kind of dysphagia manifest as difficulty to initiate the swallow. After chewing the food, when there is an attempt to swallow, there will be difficulty. And the other variety is esophageal problem, where the choking or obstruction felt more in the chest. So after the swallow has been initiated, after 1 or 2 seconds there is a sensation that something is stuck within the chest. So this is the lower part of the our digestive system, which causing difficulty in swallowing. And this type of symptoms are mostly caused by problems of our esophagus, either due to some obstructive lesions or malfunction of its muscles. So these are the broad way to differentiate and to think about the cause and its tests.
It will help us in diagnosing the cause of dysphagia.
Yes, and I want to mention one thing, that it is very common scenario that after suffering from stroke, most people cannot understand why the patient is not eating. So the problem lies in swallowing. So although it is a stroke, but the disturbance is occurring in the swallowing system.
The swallow reflex.
Yes. So that leading to dysphagia.
Okay. So now coming to the diagnosis of dysphagia, like you mentioned, a lot of clues will be obtained from the clinical history and history taking of the patient.
Almost 80-90% of the clues can be found from observing this clinical scenario, and common people can also understand the nature or site of problem of their own.
So after that, if we are suspecting any serious pathology, like you mentioned, there can be a tumor, a growth which can cause obstruction. In those cases, when we go forward with the diagnosis, what are the modalities that can be used?
Look for difficulty in swallowing. The first and foremost test we advise is endoscopy, upper GI endoscopy. So that is direct visualization of our swallowing system. And apart from that, as we have discussed the neurological problems, there are some specialized tests, one of which is called as VFSS, that is video fluoroscopic guided swallow study, which is an X-ray based test which can directly see how a food is being swallowed. Number one. Number two is there is an instrument called fiber optic endoscope, which can be inserted through a nostril, and this fiber optic endoscopic assessment of swallow is another test which can directly look to the upper part of our swallowing system. And there are some tests for function of the swallow system, like manometry. Manometry means pressure, measurement of pressure throughout our digestive system. And there is another modern test which is known as FLIT. This is one test which shows some graphical or some three-dimensional pictures, rather two-dimensional representation of a three-dimensional digestive status on a computer screen. So these are the common tests we use to diagnose and treat patients who are having difficulty with a swallow.
So now coming to the treatment will go as per the cause of the dysphagia, obviously, but would you like to discuss some common causes and their respective treatment?
Common causes, suppose the difficulty swallowing is due to some ulceration in our esophagus caused by some medicines. So simple proton pump inhibitor kind of drugs which are used mainly for treatment of acidity related problems. These drugs are wonderful and they can completely cure the dysphagia. And for more grave causes, like if there is any tumor or some membranous obstruction within our esophagus, then this can be managed by endoscopic therapy. Nowadays there are multiple armamentarium modalities in endoscopic treatment, like we can dilate the narrowed portion, we can dissect a structural membrane, a membranous membrane-like obstructive lesion within our digestive tract, and we can give some injections, all through endoscopic modality. And obviously there is some role of surgical treatment for obstructive tumors or like this. And for the non-structural causes, as we have discussed, like achalasia, so there is a very advanced treatment which is on the rise in India, that is called OEM, or oral endoscopic esophageal myotomy, which the principle of which is to loosen the tight muscle fiber around the junction between our food pipe and stomach, so that there is no obstruction. So these are the common, upcoming and on the rise and very effective treatment for difficulty in swallowing.
So now coming to the role of diet. For structural causes, there won't be any role of diet as such, but for non-structural causes, in cases where there is role of PPI, there is some role of diet. Would you like to elaborate on that?
Yes, there is a role of diet in case of one obstructive condition of the digestive tract, that is called eosinophilic esophagitis, as it is an allergic condition. So for a diagnosed case of or highly suspected case of eosinophilic esophagitis, we generally put the children on a 6-food elimination diet, like soy, nuts, bean, egg, sea fish, milk. These products can lead to difficulty in swallowing or eosinophilic obstruction. So this 6-food elimination diet can cure dysphagia in those children. But in other cases there is not much role of diet. Rather, if some tumor or some polyp or something is obstructing the digestive system, then we can shift the patient to a semi-solid or low fiber diet for the time being until the cause is treated or eliminated. So that is the role. There is no
For benefit of
for
the
benefit,
patient.
yes, for the time breach, yes.
Thank you, sir. I hope we had a very good discussion, and I hope a lot of the queries are solved.
And most importantly, how one can identify which one is dangerous and which one is not.
Which is very important in
Very important, yes.
further
Yes,
prognosis and management of the patient, and to avoid catastrophic
Yes,
conditions.
yes, yes.
So, thank you, sir.
Thank you.